Hello and welcome to my channel, and as you all know, this is about making community medicine easy. Well, this particular video is about all those students about to appear for their semester examinations in their 7th semester or the 5th semester, and this is particularly meant for the 7th semester ones who belonging to the old regulation that's not part of the CBME. And this is my effort to kind of, like one of my students mentioned that, ma'am, it's like an uphill task. It's it's like climbing a mountain. So you can say that I'm trying to break that mountain into small blocks or pieces for you all. So how about that? So let's go about it and find it out. Well, the lessons to be covered are the concepts of health and disease, screening, general epidemiology, non-communicable disease epidemiology, communicable disease epidemiology, preventive medicine and obstetrics, pediatrics and geriatrics, demography and family planning, national health programs, environment and health, nutrition and health, medicine and social sciences, health information and biostatistics, occupational health, healthcare delivery system, hospital waste management. Well, besides these also there are plenty of other small chapters which I have skipped because I have tried to keep the focus on the major ones, which are the must-know areas which you should be going through before your examination. And please do remember, this is not an all-inclusive and all possible question or all possible areas list, but this is definitely a very comprehensive core which will certainly help you all in focusing on certain basic things which you shouldn't be skipping in any condition. So let's have a look at the question pattern that's usually followed in your particular batch. That is, you'll be having 4 groups in the theory paper. Group A, you'll have 2 long questions, of which you'll have to attend only 1. Group B, there will be 3 long questions and you'll be attempting 2 out of it. Group C is about the short notes. 4 options will be given and you will be attempting 3 out of them. Group D is about explain whys and the justifies. So again, you'll be having 4 options and you have to attempt 3 out of them. So now, coming from the question pattern, let's move on to the individual chapters and let's look at the major focus areas. First, we'll be taking up the concepts of health and disease. Well, this is one of the most important chapters, and in any condition you shouldn't be skipping this chapter, even if you're planning to do so. Because as a teacher, any teacher will want their student to be very well prepared, know all, go through everything in the chapters. But practically speaking, it is very difficult to revise everything before the examination. So I will just give you certain important areas to go through. So in this particular chapter, the natural history of disease, the health determinants, the health indicators, standardization of death, this often comes as a short note, and sometimes in the practicals also, levels of prevention and modes of intervention at each of these levels. And remember, this levels of prevention is one of the crux of community medicine and you should have absolute clarity about it. And this can also come in the form of an applied question in the context of any disease for that matter. Another important thing in this chapter is the iceberg phenomena of disease. Then there are certain indicators like PQLI, HDI, DALI, which you should be knowing. Then of course, the WHO definition of health, and often it's asked, what are the limitations or the defects of this particular definition. And another important one is the health promotion. In this context, you should be aware of the Ottawa Charter. And Primary health care. This is also very important. You should know its definition. You should know the principles. You should know the octagons, that is the elements of primary health care. And of course, how it is delivered, which I'll mention later. Now coming to screening. In the screening chapter, go through the types of screening, go through the differences between screening and diagnostic tests, screening and the clinical tests, and of course you should be aware about how to evaluate any diagnostic test. That is about the specificity, the sensitivity, the positive predictive value, the negative predictive value, and at the same time you should have an idea that supposing you are asked to give a plan for a particular disease screening, what are the steps that you should be putting it down. Now coming to general epidemiology. Well, first and foremost, you should be knowing the definition of epidemiology and preferably of RJ last and the uses as well. Next important thing in this chapter are the types of study. You'll find it in my channels, all these basic steps of the major three studies, that is the case control, cohort and RCT, the differences, the advantages and disadvantages, and of course how risk is calculated in these studies, like relative risk, population attributable risk, and of course the odds ratio. Besides this, the measurements in epidemiology like the rate, ratio, proportion, and many more are also equally important. The time trains are very favorite for the long question area, and sometimes it also come in the form of the different types of epidemics. Like in this context, I would also like to mention that it is good to know the definitions of epidemic, pandemic, endemic, outbreak. And coming to outbreak, the outbreak investigation, there's a certain framework to be followed whichever disease is given. If you go through my videos, you'll also find a mention of this outbreak investigation. A skeletal framework is given in which you can feed any disease given in your question paper. Besides this, you should be knowing about the different bias in this studies, the how to eliminate each of these bias at different stages, at the stage of design, at the stage of application, and blinding, as well as certain definitions like the incubation period, median incubation period, extrinsic incubation period, serial intervals, generation time, and cases, carriers, reservoirs, the difference between reservoir and source, and the different modes of transmission, the vaccines, the national immunization program, where it is given, the site of application, the dosage, the route of administration, everything, as well as the cold chains. Now coming to the NCD epidemiology, that is non-communicable disease epidemiology, there are plentiful, but I've chosen just a handful for you, which you should be focusing on. That is like the hypertension, rheumatic heart disease, diabetes mellitus, blindness, coronary heart disease, cancer, and accident. Of the hypertension, apart from the prevention and management, which you should be focusing on each of these diseases, you should also look at the rule of halves and the DASH diet. And in the RHD, apart from the prevention and management, you should be looking into the Jones criteria. In the blindness, you should look up the preventable blindness. In the accident, you should be aware about the Haddon matrix. And in the cancer, of course, the danger signals, the warning signals, the cancer screening, cancer registry, these are very important factors to know and be conversant with them, as well as the modifiable and non-modifiable risk factors of some of these diseases. And these area is also important from the point of view that there may be BMH problems related to non-communicable diseases. Now coming to the communicable disease epidemiology, a very important one in this huge list of communicable diseases is the rabies. And in fact, it's a very examination favorite, a dog bite case coming, how will you manage and treat? It's a very common one. Then similar is the dengue and malaria management and tuberculosis. And similarly with leprosy. These are very commonly given cases where you have to, they will mention a case description and you have to identify the case and subsequently mention the treatment and prevention. Again, in the polio is an important one. It often is mentioned in the question in the form of acute flaccid paralysis case being brought and what you do about it, how you handle it as a BMH. Coming to ARI and diarrhea, this also may be given in the form of a case presentation that such and such baby is brought to you with this number of stool passage or so many cough or cold with no fever or different pictures, and manage according to the line of as per IMNCI. So this is one thing which you should be very well looking into. And coming to diarrhea, another thing is very important is the ORT, that is the oral rehydration therapy, and you should also look up the low osmolar ORS. Another important area is the STD with a focus on HIV AIDS. Neonatal tetanus is also an important focus area. Same is for food poisoning and hepatitis B, which are often given in context of outbreak investigations. And another thing is the adverse effects following immunization, which you should be aware of. The types of AFI and all. And given the present circumstances, it's always good to look up COVID-19, how to prevent and manage as the BMH, and what are the measures that you suggest, things like that. Now coming to preventive medicine in obstetrics, pediatrics and geriatrics. Of course, you need to know how do you define a low birth weight, what are the different categories of low birth weight, the MCH indicators, and how to calculate each of them, the antenatal care, postnatal care, newborn care. And in fact, these steps are very important in knowing so that you can, answer those questions where you are asked to, as a BMH, your institutional delivery in your block has gone down, or the maternal mortality has, increased, or the infant mortality rate has increased. What are the steps you need to ensure for this? This acts as backup material. Besides this, certain small things like juvenile delinquency, kangaroo mother care, then the BFHI, that is the baby friendly hospital initiative. There are some 10 pointers which you should look up. The school health services, ICDs are important ones. And besides this, in the geriatrics, you look up the major health problems in the geriatric age group. And one of the most important areas in this is the ICDS growth chart, how to plot it, how to interpret it, what are the different zones and significance of them. You should be well aware of it. Coming to nutrition and health, you should know the different types of nutrients, the micro ones, the macro ones. And here another important one is the vitamin A, which is in context of measles, malnutrition, what's the role it plays. Then is the spectrum of iodine deficiency disorders, and you should see this in in conjunction with the concerned national health program, how it is planned accordingly. The nutritional assessments, balanced diet, the different types of diets are there, particularly the one you carry out in your family. The protein energy malnutrition, filariasis, malnutrition. In fact, there's often a question, why malnutrition is considered as a tip of the iceberg. You'll find it in my, videos. So if you need that answer, you will find it in this. And also another important one as a short note is the neuroletharism, apart from filariasis. Coming to environment and health, Well, of water pollution, air pollution and noise pollution are three major areas which you should be focusing on. In the water pollution, disinfection of water, water quality adjustment, water hardness are very important areas. In the air pollution, the effects of air pollution, in the noise pollution, the control measures, and of course, in context of all this pollution, you should be having a plan of how to prevent and control, because these are practical and often asked. Waste disposal, particularly controlled tipping, is important. Biochemical oxygen demand, arthropod-borne diseases. You should know a few of these diseases. So if asked, you can mention them. Zoonosis, what it is, and also learn some of the examples of them. Then what is sanitation barrier and how it acts. Coming to family planning and demography, you should of course know the demographic cycle. Where is India right now? The national demographic goals, sex ratio, couple protection rate. In fact, these are also given like this, in your blog, the sex ratio has, gone down, or your couple protection rate, has gone down. What are the measures that you will adopt? So have a plan at the back of your mind that how you do approach such question. Then the fertility indicators, the contraceptive measures, different types, temporary and permanent, the National Population Policy, the revised one, the NEETPG Act, the unmet needs, dependency ratio are some of the ones that you should look at. The hospital waste management, you should go through the healthcare waste sources, the hazards that arise because of these, how to dispose this, the biomedical waste management, and why it is segregated at the source itself. Well, there are plenty full of national health programs, but again here I have just jotted down a few. RMNCH plus A, NVBDCP, that is vector-borne diseases, RNTCP, and the newer one, the NTEP, National Leprosy Control Program, National AIDS Control Program, Mission Indradhanush, National Health Mission, Ayushman Bharat Yojana, NIDDCP, that is concerned with the iodine deficiency disorder, JSY, Janani Suraksha Yojana, JSSK, RKSK, that is the Kishori Shakti Karyakram, UIP, ITSP, and INEP, that is the Iron Plus Initiative. Then the NPCDCS, which is concerned with the non-communicable diseases. Coming to the medicine and social sciences, here you look at just very few important ones like social medicine, acculturation, social marketing, and look up two of the most important socio-economic scales, particularly Kupuswamy and the Prasad scale, and look at the concept of social security and what are the social security schemes available in our country. Also learn that why is family considered as an epidemiological unit. Coming to health information and biostatistics, of course sampling is a very important area. So is the normal distribution, standard deviation, the central tendencies, standard error, data and its classification, the non-parametric tests like chi-square test, measures of dispersion, the sources of health information, channels of communication, the vital statistics, representation of data. So these are small things, but you need to go through once. Healthcare delivery system is also one very important one, and this actually also acts as a backup knowledge for whenever you are applying different diseases in context of the BMH questions. Always remember the healthcare delivery system is a 3-tier one in our country, with the grassroots level workers communicated at the first tier. There is a sub-center which acts as the pivot of the healthcare delivery. Next is the primary health center, and then on is the community health center, the 3 tiers. And with this, you should also know the principles, octagons, and the functions of primary health care, and the organogram of healthcare delivery at the different levels, be it the national level, the state level, or the district level. And the local level Panchayat Raj also comes as a short note. Same with IPHS, that is the Indian Public Health Standards, medical audit, and along with two important areas, that is the role of ASHA, because ASHA is one of the most pivotal characters in this healthcare delivery system. A lot depends on the ASHA. So similarly, you should also be aware what are the functions of medical officers of BPHC, because if you are aware of what are the functions of a medical officer of BPHC, then when you are asked to jot down on behalf of a medical officer BPHC in context of any disease or any given situation or any scenario, you will know that what are the functions that the medical officer BPHC can cater. Coming to occupational health, it's good to know the definition of ergonomics, the pre-placement examination, the periodic examination, the difference between them, pneumoconiosis, occupational hazards, occupational cancer, child labor, employee state insurance, their benefits, how it is devised, who all are eligible, and of course a very favorite with the examiners, sickness absenteeism. Now coming to the International Health Organization. The International Health Regulation is one of the very important ones that you should be going through. Of the different organization, I've just jotted down few for you to focus on. That is the World Health Organization, UNICEF. And in this context of UNICEF, you should know the Gobi FFF and the Indian Red Cross. Besides this, you should be aware about what are the vaccination needed for international travelers, what are the notifiable diseases, what is emporiatrics, and of course in this COVID pandemic, everyone is aware but still need to go through isolation and the difference between isolation and quarantine. Hope this is of help to you. Thank you so much. If you haven't subscribed to my channel, please do subscribe to my channel. It means a lot to me. It motivates me to bring more academic contents for you all. And I must say I feel very fortunate that you people request me, give me the opportunity to help you better with your studies. I definitely take that as a blessing. Hope you like this, and to like, share and subscribe once again. Happy studying.